clinical utility of the RDW, which is the better one. We have two things in RDW, that is a red cell distribution width. We have got SD and CV. Could you explain more in detail about the RDW, doctor?
Yeah. So that's a very good question. And RDW SD, RDW CV. So what is that? Red cell distribution width is a biomarker that quantifies the variability in the red blood cell size, pointing to the level of anisocytosis in the complete blood. The normal range of RDW, this is CV, is 11.5 to 14.5%. Now, I was baffled to see that the RDW has so much of clinical significance. Apart from hematological disorders, people have done studies and found that it is significant in trauma, predicting sepsis, to see the progression of kidney disease, coronary vascular disease, cerebrovascular accidents, cancer, pulmonary disease, endocrine disease, sepsis, age. Of course, it's a research parameter, but very valuable because it's easily available in our CBC reports. There is an article here from which, this is a courtesy from where I got this particular image. Next. So which is better, RDW SD or CV? Before answering the question, let us understand how they are derived. So RDW CV is a calculation based on the width of the distribution curve and the mean cell size. That means it is one standard deviation divided by the mean corpuscular volume. So let us remember that RDW CV is dependent on the corpuscular volume. All right. Whereas RDW SD is the actual measurement of the width of the red cell distribution curve in femtoliters at the point that is 20% above the baseline. So this gives you more true picture. It is not dependent on the mean corpuscular volume. All right. So in a way, you can say that RDW SD has a certain advantage here, that it is actual measurement of the red blood cells and it has a unit femtoliters, right? So RDW, as I mentioned, is the deviation of red blood cell width, not the actual width, because it is a calculation, is dependent not only on the distribution curve, but also on the MCV. So there is a pitfall, or one should be aware. A homogeneous population of red cells with a narrow distribution curve and a low MCV may have an elevated RDW CV. All right, nothing to get panicked, but just you need to remember this, that there is a narrow distribution curve, low MCV, so elevated RDW CV can occur. Again, one more condition is there can be a heterogeneous population of red blood cells with a broad distribution curve and a high MCV. This may still have a normal RDW CV. So you can actually use that knowledge and then we can classify anemias, which I'll come to the next slide. Having said that, RDW SD, as I told you, is the actual measurement of width of red blood cells in femtoliters. It's kept at a cutoff of 20% above the baseline. All right. So the normal value of RDW SD can vary in different resources. So one resource we follow is 39 to 46 femtoliters. So this is how you can utilize now. If you know about your MCV, if you know your RDW, if you know your retic count, and if you have a good clinical picture, you can actually sit down and classify the anemias and look at the clinical correlation. So again, I don't want to go in detail into the table, but this is just food for thought, that RDW is a valuable parameter. Next time you have a CBC report, when you look at the iron studies, actively look into your RDW, actively look into your MCV. If you have a retic count, very good. It will throw out some interesting observations. All right. So I will stop sharing my screen.
Yeah, quite interesting, doctor, to understand the value of the MCV and the RDW and how to get on to the differentiating type of anemias itself from the laboratory itself. That's the beauty of the automated hematology analyzers which we are using today. So